So the reason that day treatment is beneficial for working with people with eating disorders is that it allows us to keep them in their own homes.
It's working with people in their own lives, so their life is still continuing, whether that is school or university or work, and yet they need this special attention on a particular area of their life that is likely to be impacting every area.
Having a daycare treatment is the space to grow and to practice those skills.
Even small things like using public transport and being out in the community every day is really, really helpful. It provides us with an opportunity to really understand the challenges that they face as they go, kind of come alongside them in a way that doesn't take them outside of their natural environment.
They can take that straight out into their everyday life.
And you can actually find out how they'd got on the night before, how they'd managed within the community, how they'd managed within their relationships at home, how they've managed to cook for themselves.
Families can come along to get some ideas and strategies about how to bring that recovery safely home.
This works on mind and body at the same time, and everything kind of gradually improves together.
Unfortunately, often outpatient treatment is just monitoring people until they're unwell enough to require inpatient treatment, which of course is just appalling.
I think sometimes when people come into a hospital, it can be very, very difficult for them to remove themselves completely from their relationships and the family background, and then they often find it very, very difficult to leave because of the safe environment.
It's such a big transition out of being in a hospital to being at home.
You often see the same names coming through over and over and over, that kind of revolving door situation. We didn't get that in the daycare service.
We keep everything kind of working simultaneously and alongside each other, and so it becomes a more natural transition from being in treatment to being in life. They kind of blend and cross over one another.
You don't see the same people coming through those doors over and over and over.
There are places in the UK where there's no eating disorder facilities at all for hundreds of miles. But Orri is, I think, a groundbreaking service which introduces daycare, a standalone daycare service. It's filling a gap which is sorely needed.